members of all ages with special needs. Before moving to Memphis, Nisa was on an adult surgical oncology unit at New York Presbyterian Hospital. In Memphis, she has served on a medical surgical unit at the VA, works in the Office of Levy Dermatology, and is camp nurse at Camp Durham. She is working toward her master's as a family nurse practitioner. Rebekah Kaplowitz received her medical degree from the Mount Sinai School of Medicine and completed her residency in primary care internal medicine at Brown University. After a 3-year fellowship at Harvard University in general internal medicine, she worked as a primary care doctor at the VA in San Diego and faculty at the University of California, San Diego. Currently, Dr. Kaplowitz is an associate clinical professor at UT Health Science Center and is the medical director of women's health at the Memphis VA Medical Center. And she would like you to know that the views and opinions that she expresses here today are her own and do not reflect the views and opinions of the VA. Thanks.
I titled this skit, the following skit, Don'ts and Do's, Communicating with Your Doctor, because ultimately 80% of medication errors are caused by miscommunication. And it all starts with the patient-doctor communication. So what kind of cues are you communicating, and how does your doctor adjust their response to, and that all can affect the outcomes. So today I won't be focusing on the good versus the bad communicating on the part of the doctor. Rather, the scenarios presented will be typical cases of what a patient might say with an explanation of why it's helpful if the patient does or does not do an action. So let's start by going over some don'ts and do's when communicating with your doctor. Rebekah will be playing the doctor, how fitting, and Mrs. Barbara Virginsky will be playing the patient, and Chava Schneider will come in later as a surprise guest, and I will be the narrator. Please note that the following scenarios are not actually related. So, scenario 1 is presenting your story.
Hi, I'm Dr. Kaplowitz. How are you? How are you doing today?
Oh, I'm just fine. My knees have been feeling kind of funny lately, and my stomach hurts, but I'm just fine.
That was a don't. Why? Because this is probably the most critical point for the patient in the doctor's office. You have an opportunity to present your story with details that the doctor can base their full diagnosis off of. So, don't be vague. In the doctor's framework, this is known as a chief complaint, and it's the starting point to figure out your diagnosis and treatment plan. So instead, do this.
I've noticed that sometimes when I walk upstairs, my knees feel weak. Also, my brain feels like scrambled eggs sometimes, or regularly, and my stomach has had this very sharp pain right over here, which is maybe like about a 5 out of a 10. I have had a low-grade fever, and I have had vomiting. It all started about 4 days ago when I got out of bed in the morning, and there's nothing that I can do to make it any better. It just seems like it's getting worse as the days go by.
So this was her opportunity to define her issues. It's also called the history of present illness. The doctor is trained to listen for the details that you are describing, but also may guide you through a series of more closed-ended questions to define the problem in medical terms. So having details in advance gives opportunity for you and the doctor to see the nature of what is happening. So know why you are coming. Be able to point, describe, know the timing. I wrote this on your handouts in case you don't remember later. Know the timing, know when your last period was, how often you have a bowel movement, how to describe details about it. Don't be shy. Diet, appetite, sleeping, urination, that really is important not to be shy about it. What makes the symptoms better or worse? What happened at the same time as the symptoms? For example, if you were in a car accident, versus if you had screaming kids when your headache started, that can make a difference in terms of diagnosis, right? So anything associated with how you're feeling. For example, with your headache, you have hurts when you look at bright lights, or your neck is stiff, or you have vomiting with it. So do include anything that could clue the doctor in to what diagnosis and treatment they will pursue. It's helpful to have a list beforehand, and I will go over your helpful handouts at the end time committee. So do not feel you have to say all of this in one shot to the doctor. Rather, it's something for you to be mindful of and massage into your conversation throughout your visit. So, scenario 2 is the self-educated patient.
Thank you for letting me know about that herbal supplement you've been taking. Where did you get that information?
Oh, I looked it up on the internet. No offense, but you know you cannot really trust the medical field these days. I needed to take matters into my own hands, so I looked on WebMD.
So that was obviously a don't. It is a good thing to be an educated patient, but in the end, you have arrived at a healthcare provider. So recognize that you are coming to them for their advice and acknowledge their training and expertise. Instead, you can do this.
I looked on the internet, but because I know I don't know everything and I haven't received a lot of satisfying answers from other doctors that I've seen about my medical issues, I'm bringing you my issues because you are my expert. I did look at sources that were kind of relevant within the past 7 years, and they were all from reputable sources.
So presenting the fact that you are an educated consumer in this manner is less threatening, and the doctor can appreciate that you're seeking their consult and not doing so in a reluctant way. So they will receive you with a better attitude if they know what issues you've had with prior medical providers so that your specific concerns can be addressed. Scenario 3. How to present self-kept records.
Can you tell me more about that symptom?
Yes. Yes, I actually have lots and lots and lots and lots of papers to show you. I have a very big binder. And I have all these worksheets right here that I've been doing the self-management journaling on. Big binder, lots and lots and lots of stuff. It would be great if you could go over and see if you notice anything that's abnormal. Oh, darn, I forgot what my first question was supposed to be. All those questions, they're on the tip of my tongue. Oh well, in the meanwhile, I wanted to ask you, how's your family? Has Sophia gotten that job that we were thinking about? Did she have that baby yet? And was it a boy or was it a girl? Oh, and I meant to tell you, we just bought a much bigger house, and I'm so much happier. The ceilings are much higher in this house, and and there's so much more lighting, blah, 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 blah.
I don't even know where to start.
So, worksheets such as the ones that I will present to you at the end of the scenario segment are wonderful tools for you to better understand and keep track of your progress, especially when you're dealing with a chronic disease or chronic pain. They are also an excellent guide for working with members of your healthcare team outside of the face-to-face visits, such as phone calls or with your nurse or emails with the doctor's office. However, you should be able to narrow down major points by the time you get to the doctor's office that you would like to discuss in the short 15 to 20-minute window that you have with them. Another note, keep small talk down to a polite minimum. Maximize the time that you have so you get the clearest story of yourself across. And so this is what you can do instead.
I hope your family is well. I cannot wait to catch up with you when it's not taking other patients' time. I've actually been keeping detailed journaling to track my progress as well as other documentation. Let me know if that would be helpful for you to look at any time. I did write down 3 major questions that I have and I want to discuss with you today, though namely my pain management, possibly changing my medications since I think it's causing side effects I'm not happy with, and any suggestions that you might have for activities that you think won't injure me any further. The rest, I can either speak to you, the rest of the team about, or I can save you for a follow-up visit in a couple of weeks from now. I understand that we do not have so much time to work right now. You can also let me know if there's any time at the end of the session for me to ask additional questions.
So going into your appointment realistically can help manage your limited time. Yes, you have many questions and concerns, but realistically, you only have 15 to 20 minutes of appointment, and realistically, even less allotted for face-to-face time with your doctor. So do as much organizing as you can beforehand to narrow down your questions to 3 major ones. Probably a good number, so if you know your details well enough, in fact, some of your other concerns may be resolved even in answering those 3 questions. Otherwise, rely on the fact that if this is a chronic thing, you will have to follow up. You will have follow-up visits, and if it's a one-time thing, you can always call the office or even email sometimes to have other questions answered. Also, it would be very helpful for your reference needs if you brought to the appointment a legible document, and this is also a note that I included in the last form in your handout, with your medication history, up-to-date medication, vaccine history, contact info of other doctors you see, know your past medical history, know your family medical history, your surgical history, along with your journal sheets, if need be. When did your symptoms start? On what part of your body? What makes it better or worse? What treatments you have tried and how they worked? How and whether it's happened before. So all of these can really help with your diagnosis and treatment. In the waiting room, the doctor will ask you to fill out a review of systems of your body. Read that little form that you sit there filling out before each appointment that you do a million times. So this is a chance for you to briefly mark any abnormal symptoms for them to know what they will need to focus on during the visit. So scenario 4 is be and bring an advocate. Be or bring.
I'm going to order that medication for you. Did you understand anything I said?
I guess so.
So the don't is also that's a terrible question.
here's the do. So to be honest, doctor, my friend is usually a little more of a minimalist when it comes to medications. Can you explain a little bit more about what the medication does and why she needs it and what kind of side effects she's going to have in layman's terms that we might be able to understand? And can you write it down for us, please, so that we don't forget? It's a lot of information we're getting here right now. And honestly, I just think it would be, my friend here would be more comfortable if she could think it over a little bit before just taking the medication that she's never heard of before. Also, is there maybe a little bit more of a natural or maybe less invasive alternative plan to what you're suggesting that she may be able to start with? I've heard a lot about homeopathic medicine, and I think that might be a real good idea. But maybe that depends on what you think, and we can discuss this. I just want to make a note here about all the medications that you're saying, so that we can look at this information and that way she'll actually take it after you prescribe it for her.
So ask the doctor to repeat and explain and even draw or write down if you need that. Have a trusted friend take notes for you if you're not up for it. And also to serve as an advocate, because they can sometimes speak things that you wouldn't necessarily feel comfortable speaking. They might know you well enough to do that. Write any questions for next time as well, otherwise you will forget. If you are hesitant about taking a medication, don't feel you have to take it simply because the doctor is prescribing it. Don't be annoyed about it either. There's a way to deal with that. They're trying to work with you and give you options that suit you. If you don't understand your medicines or the tests that the doctor suggests you get, or you have no interest in taking them, you will most likely not be compliant, right? And then you're back at square one. And so if you get the information you need so that you can get the best treatment that you can get, that would be the best scenario. Also, it's sometimes hard for doctors to not talk in medical leads, which is hard to understand medical terminology because that's just the language that we know. So it's okay and even necessary for you to ask that which you do not understand and for you to bring up any concerns you have with an indicated treatment. Learn to be your own advocate. If you cannot, bring one with you. The doctor will be happy because they want you to understand what they have actually said, so you're more likely to be compliant. Scenario 5 is announcing your intentions.
Okay, Mr. Litsky, I look forward to seeing your progress next time. Have a great day, and thank you.
Okay, wait. Don't go yet. I have a lot of questions. Oh, I completely forgot to ask you so many things. Can I just ask you before you leave, please? The first one is, where is my liver? Is it over here? Because I'm not feeling so good over here.
This has just completely derailed the doctor. Here they're keeping pace and they're not going to keep their next patient waiting. And then, bam, they get hit with a list of questions and maybe even come back to you more grumpy or rushed just to understand their perspective, what's going on behind the scenes. And if they're even willing to answer them, you're going to have kind of a negative attitude with that. So now they may have to redo a physical exam because you just mentioned that your liver's hurting, basically. And so something potentially serious and we're considering in their first pass, they now have to think about and go over again. So instead, you can do this.
Hi, it was so nice to meet you. I know I'm here for sinus infection, but there are 3 or 4 other things that I really would like to discuss with you this time, permitting it within a short 15-minute visit. And otherwise, we can discuss it at another time that's better, or I can make a follow-up appointment to discuss those things.
So in this last scene, we see that the patient is announcing their intention at the beginning of the session, as well as any questions or concerns. Such a strategy enables the doctor to have it in their hands to decide whether or not they will have the time to hear your question. They may even want to hear it up front, since it may change their whole physical exam before they do it, and they can take your question into account for diagnosis and further treatment. Asking when the best time for your next appointment will help provide definition for your health care and leaving you less anxious after your visit. Another option is to alert the doctor's healthcare team in advance of the visit about your other concerns, by phone or email, when available. And that allows the team to prepare for the proper length of the visit. So in conclusion, the doctor only sees a snapshot of your life. So fill in as much detailed information of your story as you possibly can, since this will ultimately determine your diagnosis and then treatment in the beginning at least. If worksheets or journaling helps you, use them, and I'll go over some handouts. Learning self-management strategies well before you even step foot in the office can assist with avoiding miscommunication. Remember, you are managing your care the whole time that you are not in that doctor's visit. So learn and get in tune with yourself as best as possible. Stay as organized as you can. Build a great support team with family, friends, and healthcare teams. Ask for references when you need to. Just to know, knowing when to fire your doctor is also a key ingredient to your healthcare. If you feel it's something that they can work on, then don't be afraid to work it out with your doctor and communicate your needs. Most doctors want to help you live better, and when you aren't satisfied with their care, chances are they're also feeling frustrated by some miscommunication. If it is simply meeting of the mind and you do not feel cared for, it may be time to move on, or at least get another opinion. But in general, the more prepared you are to give over and share your story to your caregivers, the more understood you will be and help your healthcare team be able to come to a clear diagnosis and treatment sooner. Just want to thank Rebekah for helping me go through the whole script. And thank you to Lara and Papa for being multiple participants. I want to go over with you the source sheet, the treatment sheets quickly. Basically, what that is, I found the packet, the great packet I found at www.pipain.com, and it's mainly for chronic pain treatment. It's just charts that helps you to chart your progress and diagnosis. I will let you read those at your leisure. Let me know if you have questions about that, but I highly suggest, especially if you're going through something long-term or anything, or even if you just want to start documenting your journaling, then those are awesome sources to use. And there's just some takeaway tidbits. Thank you, Rebekah, for writing those up. And are there any questions? What does the doctor do? When does the doctor look at the papers? Right before they walk into, well, you can answer, doctor.
So some of that information is actually recorded by the healthcare team. So the medications that you or your family member is taking might be recorded by the medical assistant in advance of before you even see the doctor. So some of that is being transcribed without the doctor seeing it just yet, and it's being kind of recorded for the note and for review all kind of in advance. Some of this journaling that goes on is more tracking between visits and sort of one's own self-awareness of their symptoms, so that you can monitor side effects, the effect of some medication, changes with medicine, but with the big binder of self-management sheets, while it may be very helpful, between each visit, it's generally not reviewed by the doctor at the visit, but kind of you being prepared for the visit with kind of a summary of the knowledge you've gained by self-monitoring is what kind of makes that visit more efficient, to be able to discuss that blood risk, to discuss those factors that make whatever treatments have been involved more effective or less effective, especially when it comes to medication side effects that the doctor needs to be aware of and manage. Does that make sense? Did that answer your question?
So you're saying that you've never seen something listing the effect of the medication. So what my point was, that's for your reference. So you know I don't want to take this medication again because when it's a blood pressure medication, I had shortness of breath, I was urinating way too much, like too many times for me to be able to make it to the bathroom door. It's just I need a different medication. So for you to have in your reference, this is a medication I have taken in the past, and I do not want to ever take it again. They did not ask you are right. And so that is why you have to come prepared you don't have to present this all to the doctor at once. This is something for you to say. If the doctor says, oh, I'm going to put you on Cinepril, and you're going to be, that's a blood pressure medication, and you're going to be like, well, wait, I'm pretty sure I took Cinepril. Let me see, I have my handy-dandy sheet with me. You refer to. Yeah, that medication had a really bad effect for me. It's simple, it's quick. Instead of going home, taking this medication, and realizing this is the same exact medication I took 10 years ago that was horrible, that I already got off, that I